Good day everyone, I am Janine, Lachica, and together with me are Faye Grijaldo, Louise, Hinlo, and Cedric, Inocencio, presenting a study on behavior risk, work-related factors, and common health problems among garbage collectors. The purpose of this study is to assess the prevalence of health issues commonly faced by garbage collectors and to identify the factors that may contribute to these health challenges. Further research design, the study utilized correlational type of research design and survey method with the use of researcher-made questionnaire. Participant descriptors includes working over 6 months, consenting to participate, and exclude those who withdraw or do not agree to join. Involve 50 garbage collectors from City Environment Management Office of Bago City, with total enumeration method was utilized with a pilot test of 12 participants.
For the research instrument, the researchers use a structured researcher-made questionnaire. Section 1, Demographic Data, collects basic information to link demographics with health outcomes. Section 2, Behavioral Risk Factors, assesses lifestyle habits that may impact health. Section 3, Work-related Risk Factors, identifies job-related risk affecting health. And Section 4, Health Problems, evaluates common health problems and their possible causes. The researcher used validation and reliability. Reliability testing assess using Cronbach's alpha to confirm reliable measurements across sections. Goodance gates from validity ensures that each item accurately reflects study objective through expert review and field testing. This study shows of 50 participants, 50% were middle-aged adults, 38% were young adults, and 12% were older adults. For marital status, most participants were married, which is 64%, 28% were single, 6% single parents, and 2% widowed. For educational attainment, 60% finished high school, while 20% each had only elementary or college education. Number of children, about 32% had 1 to 2 children, 18% had 3 to 4, and 16% had more than 4 children. 34% have no children. Table 2 shows middle age had the most health concerns. Musculoskeletal, gastrointestinal, and respiratory had 42% and dermatological 44%. By education, those secondary education had the highest cases. Musculoskeletal 48%, gastrointestinal 54%, dermatological 52%, and respiratory 46%. By marital status, married workers reported more problems. Musculoskeletal 52%, gastrointestinal 54%, dermatological 56%, and respiratory 54%. By number of children, those with 1 to 2 children had musculoskeletal 24%, gastrointestinal 26%, dermatological 28%, and respiratory 26%.
Level of behavioral risk factors among garbage collectors using mean, standard deviation, and rank was examined in the third table. Garbage collectors showed high adherence to healthy habits like proper sleep, hand washing, bathing, and low rates of smoking and alcohol use. These behaviors reduce health risk and help reduce pathogen exposure in high-risk work environments. Supporting research by Janine et al. Emphasized that knowledge and attitude influence hygiene behavior, and though actual compliance can be hindered by limited access to water, sanitation, or PPE. Table 4 showed work-related factors among garbage collectors using mean, standard deviation, and rank. Table 4 shows many garbage collectors hold multiple jobs, leading to possible fatigue and health risk. Meanwhile, training levels are very low across all areas, highlighting poor safety preparedness. Supporting studies by Melako, Anteruni, and Lisa link long working hours and lack of training to more health symptoms, injuries, and burnout among waste collectors. Table 5 of the study examined work-related risk factors among garbage collectors using frequency and percentage. The findings showed physical and environmental risks faced by garbage collectors, showing that most workers endure long shifts, heavy lifting, prolonged walking, and static loading, all contributing to fatigue and musculoskeletal strain. They commonly operate dump trucks and work in mixed routes, exposing them to varied and unpredictable conditions. Supporting research by Punkasem et al. Found that such physical demands, including repetitive movements and poor posture, increase the risk of chronic injuries among waste collectors.
Table 6 of this study revealed a significant relationship between age and dermatological problems among garbage collectors, indicating that certain age groups were more prone to skin-related health issues. This finding was consistent with Rahe and Patil 2020, who found that garbage collectors aged 15 to 75 frequently experience skin problems like pallor, dryness, and itching. The study found no statistically significant relationship between behavioral risk factors and demographic profiles. However, high behavioral engagement, including work commitment and hygiene practices, was consistently observed across all demographic groups. These findings align with Dianita 2022, who highlighted strong hygiene practices among garbage collectors regardless of their education.
This table shows significant relationships between demographic profiles and work-related risk factors among garbage collectors using chi-square tests. The significant findings are as follows. Age was significantly related to the duration of long walking periods per shift, suggesting older workers are more likely to engage in physically demanding walking tasks. Marital status was significantly associated with the type of collection vehicle used, possibly reflecting role assignments based on perceived reliability or seniority. Educational attainment significantly influenced the number of shifts worked daily, indicating those with higher education may negotiate or be assigned lighter workloads. The number of children was significantly related to perceived weight load per shift, implying that workers with more dependents may accept heavier physical demands.
Demographic characteristics significantly affect health risks and working conditions among garbage collectors. Despite these challenges, participants demonstrated consistently high health-promoting behaviors, especially in hygiene and sleep routines. Age was significantly related to dermatological issues, while work conditions such as working duration, collection vehicle type, and perceived physical strain varied depending on marital status, educational level, and number of children. To address these occupational health risks, it is essential to strengthen worker protection policies, deliver targeted safety and health education, improve access to early medical interventions, and promote family support for hygiene practices at home, and encourage more research on long-term solutions.
Recommendations. Based on the findings, several key stakeholders are encouraged to take action to improve health and safety of garbage collectors. Local government units, health officers, and waste management officials should enhance policies, healthcare access, and training systems, while collectors and their families must practice preventive health measures. Future researchers are urged to explore long-term solutions and address system-level gaps to strengthen occupational protection. Utilization. The study's results will be provided upon request to the USLS College of Nursing, university administrators, and academic bodies involved in shaping the curriculum and delivering student support programs. The findings may serve as a basis for enhancing workplace safety measures, promoting hygiene awareness and preventive health practices, and developing targeted interventions to improve overall well-being. It can be used as a foundation to improve resilience-building initiatives within the nursing curriculum, enhance student well-being, and promote skill development and professional readiness among student nurses.